Hi, I'm Steve Stahl. I'd like to tell you about a new book that's coming out I'm very excited about with Mike Cummings, who is a colleague of mine at the California Department of State Hospitals. And we're talking about managing complicated patients. So we've actually titled this Managing Complex Treatment Resistant Psychotic Patients. And really, this book fits with a triumvirate of books that are coming out at the same time. We have a practice at this 7,000 patient, 5 hospital department of psychiatry, essentially state hospitals in California, which Mike Cummings has created a psychopharmacology consult service many years ago. And we've stumbled upon essentially practices that will help the worst of the worst. So, for example, in California, what does that mean? We have 40 million people in California. Roughly 1 to 2% of them are seriously mentally ill, we know by just studies. So that could be up to 800,000 people are seriously mentally ill. Maybe half of them are not so sick, and they respond pretty well to medicines, and they take their medicines. But of these 800,000 people, guess what? There's about 50,000 of them in California jails at any time, and there's about 50,000 of them in California prisons at any time. And so the sickest patients are in prison and in jails, but the sickest of the sick are in the psychiatric hospitals. We only have 7,000 patients. Can you imagine what small percentage this is of the 800,000 that are out there? And so these are patients that are the sickest. They don't respond to medications. They've been in and out of jail, usually 14 times or more before they come to the state hospital. And they require aggressive treatment, and they're often there because of a felony. They've either had rape, or they've had murder, or they've had attempted murder, or bad assault. So these people are also schizophrenia. So they're all in the state hospitals, and over the course of a lifetime, several of my colleagues have figured out ways to treat them. And so we thought we would memorialize that in a book. So half of the book are narratives about how you treat these complicated patients, each symptom profile from psychotic symptoms to anxious symptoms to problems with sleeping to problems with mood. And the last half of the book is essentially a prescriber's guide for how you use these drugs in a different way than you do for patients that aren't so complicated. So this is habit and practice. We've done it well. We've reviewed the literature where it exists. We've shown you our results from our own empiric trials where it exists. And as I said, it's a part of a triumvirate. So the way to treat difficult patients in psychiatry, in jails, prisons, and state hospitals, as well as badly affected outpatients, would be the clozapine book with Meyer and myself, the plasma drug levels book with Meyer and myself, and the complex treatment-resistant psychotic patient with Cummings and myself. And our group at the California Department of State Hospitals has written all the different chapters in there. So it really comes out from our group, and we have now moved this around the world. We have colleagues in Australia that are adapting this way of practice that we work with actually every month on a case series. We have colleagues that we're starting up with Ireland. We have interest in the UK at the Broadmoor Hospital. We have interest in Italy, as I mentioned. So we're very excited that we're using these 3 books as essentially a curriculum to roll out the treatment for these patients, because usually textbooks talk about treating the majority of patients, the 80% for which there's good evidence and lots of trials. And everybody, that's the bulk of them. But you know what? When you're a psychiatrist, if they're not difficult to treat, they're not coming back all the time. So your day is spent taking care of the difficult patients. And there's really has not been until now a textbook for that. So that's these 3 textbooks are to hit that and show people who work in these settings how to do it. The medication guides for the complex patients have a little bit of an analogy to my prescriber's guide. So if you know, my prescriber's guide's got sections on, what are the indications, what's the dose range. But in this particular prescriber's guide in the complex cases, it also has guidance for how to dose with plasma drug levels. So in some ways it intersects a little bit with the plasma drug book. But the section for each individual drug and the levels for each individual drug are also in the dosing sections. There's also tips about how you treat patients that are specifically more difficult, the drug interactions they're likely to have, and so forth. So it has a sensor, it has a look and a feel, just like the prescriber's guide. It has the colored sections, it has the the side effects. It's got tips and pearls, which are like little fancy things you do that are specific for one drug that are really not so much evidence based as they are anecdotal. But these are anecdotes from experienced clinicians. So that would help guide in a way. You can't get that information really anywhere. That's where we put it down. It was a labor of love to put it down. We're glad we've done that, but you can't get this information elsewhere.